Next up is YNP10, a KLA short interview feature where we ask our guests 10 questions and they have the option of answering yes, no, or pass. And they can give comment on any questions they like. All right, question 1. Is the IFR, or infection fatality ratio, more important than the number of assumed cases?
And you're talking about specifically this virus?
Yes.
That we've never isolated and
Right.
can't even identify?
Right.
So most of these ratios, okay, so normally with those ratios, you would look at the fatality per an actual case, like a person that was truly sick. Right? And we don't have that data because most of the people that test positive. Okay, so that's one way of saying it, the number of deaths per people that are sick. We don't have that data.
Right.
Another way to look at fatality rate is per population, like
Right.
the number of deaths, per the population. So, and what was the second piece?
Is the IFR more important than the number of assumed cases? Like we have a case-demic going on, right?
Yes.
But I've read
Yes.
articles that say, no, it's the it's the lethality that's important.
Right.
Not the cases.
Right, and we don't even know what the lethality is. Because we
Right.
don't know what these people are truly dying from. And
Right.
so, when I talked about that in my first talk back on April 5th, if we don't even know what they're dying from, how can we even have a rate like that?
Right. So almost impossible to answer that question.
It's impossible to answer it intelligently.
Good, I'll take that as a
cogently.
pass.
That's a long story short, a pass. I forgot we had the pass option.
Right. Do you think face masks interfere with normal breathing?
Yes, some people more than others.
Okay.
Yeah, I had a case here of a patient that was sitting in my waiting room with a mask on, and I said, "Are you sick?" And she said, "No." She said, "But I'm feeling sick wearing this mask." And so I said, "Okay." Well, so she got up, we walked back together. She sat down. She was short of breath. I checked her oxygen saturation with my O2 sat, on the finger, and it was like 88%, which is low for her. She's an older person with a lot of medical problems, but that was low for her. She's usually in the 90s. And so I said, "Well, how about you take the mask off?" And she did, and it went right up to 98%. And she, no. I asked her to take some deep breaths with the mask on, and it dropped down even further. And then I had her take the mask off, and it went up to 98%. So that's one case of that person was really struggling. She told me her subjective struggle. I got it objectively. That does not always happen with people because I've tried the mask test on myself, and it doesn't work, and there's no drop in O2 sat.
Right.
So it really depends on the person, probably depends on their underlying health and age and things like that. But in this particular case, I saw it. I saw it happen.
Right.
And I had her subjective complaint.
And couldn't you argue that even if you can't find, even if a physical manifestation like less oxygen or a perfect physical explanation of what is going on, even if there's a mental issue, couldn't wearing the mask be a mental problem for some people?
Absolutely. Yeah, there are people that were, physically abused as children, and they have a hard time. They can go into a panic attack having anything put over their face.
Right.
Absolutely. And then there's people with kids in high school with acne, and their acne gets worse. I mean, there are so many problems with the mask. So I think I answered yes to that one.
Yes. Is it true that many media reports of young and healthy people dying from COVID-19 turned out to be false?
There were definitely cases like that. There was an early case this was back in March or April, I think, and it was a child that they said died from COVID, and it was actually somebody that had a little baby that was very, very sick, and I think it was like a ruptured intestine or something. They had nothing. So there are a lot of cases of that. And the last time I looked at the stats, the national stats on people age 0 to 17 years old, it was 105 people in that age range that allegedly died from COVID. And to put that in context, over 18,000 people of that age had died from other causes, usually something physically traumatic, like a car wreck or an industrial accident or a suicide or a homicide. So over 18,000. So 105 doesn't even register. And who knows what those children died from. So, and they were talking about Kawasaki syndrome for a long time. And Kawasaki syndrome has been with us since the 1950s when Dr. Kawasaki first coined the term. And they were using that. And 1,000 kids a year get Kawasaki before COVID. And they almost all survive. So yeah, long story short, I think I answered yes.
You did. Summer just ended. Now it's snowing outside. And so seasonal sicknesses will be on the rise, as they always are. Do you think regular cases of the flu and cold will be falsely blamed on COVID-19?
I think it's already happening because we've had 0 cases of influenza in the Flathead. So either COVID cures it, influenza, or there's something else going on.
Okay.
So I'd say yes. Mm-hmm. High probability.
Right. Assuming this virus is a typical seasonal coronavirus like the flu, could it have been essentially eradicated months ago if we had allowed it to be transmitted from healthy person to healthy person, as is the case with the flu and common cold?
I'll pass on that because there's no evidence that it even exists.
Okay.
So I'll pass.
Pass. Mm-hmm. As we see spikes in cases, will the healthy folks who have ignored shutdown orders and gone without the masks be blamed?
Yes, they're already being blamed.
Right. Okay. According to the local paper, as of Thursday, 23 residents in Flathead County have been killed by COVID. Can we be certain that these 23 deaths were a result mainly or exclusively of COVID-19?
No. The only way to know that is if you got in on the individual cases. And a couple of the cases I do know a bit about, and they were both very elderly people with a lot of medical problems, and one of them wasn't expected to live very long anyway. Whether they even had a COVID positive test done or if they just assumed that it was COVID. So those are 2 cases. You'd have to know quite a bit about the cases to even make such a judgment. I had a patient, there was a woman I know who went in the hospital with an orthopedic fracture. She had no fever, no symptoms whatsoever of respiratory illness, but she happened to test COVID positive, was put on our COVID wing, isolated on our COVID wing, had no symptoms whatsoever. She was in her 90s. If she had passed away, they would have said another one died on the COVID wing.
Right.
But she went home 2 days later.
Next, and you're going to have to keep your composure here. Does Bill Gates have your best interests in mind when he urges you to get the shot?
No.
Okay.
And what are we even making the shot to when we haven't isolated the virus?
Right.
It makes no sense.
I've seen a lot of Donald Trump flags and bumper stickers in these parts. One flag I saw said, and I'll paraphrase, Trump 2020, enough BS. If Trump is elected, can we all breathe a sigh of relief knowing that he'll put an end to this madness?
No. He has promoted the military, delivering the vaccines. He's gone back and forth with promoting masks or not, so I would say no.
Okay. Last question. I think I know the answer to it. Are you going to take the shot?
No. Decidedly no.
Okay.
And I would say probably the majority of people in the Flathead will not, and probably the significant, sizable majority of Montanans will not.
Right. Okay. Well, Dr. Bukacek,
thank you
very much.
That was fun. I'd like to do that again.
All right, great.
All right.